Dr. Neha Narula, primary care physician at Stanford Health Care. Thank you for joining us. We know polio is a viral disease that can be deadly, but what exactly is polio? We know there are different types, and what are the initial symptoms?
Thanks for having me, Ryan. Yes, so polio or poliomyelitis, often it's known in the medical world as that, is a highly contagious, disabling, and sometimes life-threatening disease that is a result of the polio virus. Now, there are 3 known types of the polio virus, of which type 2 and type 3 actually have been completely eradicated since 2015 due to such a strong vaccine campaign worldwide. Now, we are still seeing cases as a result of that type 1 poliovirus that still exists. And most people actually, when they get infected with polio, the poliovirus actually will not have any symptoms. About a quarter or 25% will have flu-like symptoms initially with symptoms like fever, sore throat, headaches, weakness, and sometimes gastrointestinal symptoms like nausea, vomiting, abdominal pain, or cramping. Now, a smaller portion of individuals will have more severe symptoms, things like meningitis, which is inflammation of the membranes around the brain and spinal cord. And like we saw in Ms. Myers' case, some will develop paralysis, which ultimately leads to a permanent disability. Now, paralysis is most commonly seen in the lower extremities, but can often affect any muscle in the body, including those that are responsible for breathing or respiration, and therefore can be life-threatening. Additionally, I also wanted to take a moment to describe the post-polio syndrome, which can happen often years to even decades after the initial infection that an individual can fully recover from and not have any post symptoms until decades later. And these can include pain, disability from late onset paralysis.
And as you had mentioned, polio has largely been eradicated, but it is still around these days. So how exactly common is it, and how does it spread, and who is most at risk?
Absolutely. So polio, Ryan, in fact, was known as the major cause of paralysis in children just a few decades ago. And just to put things into perspective, back in 1988, we were seeing about 350,000 cases worldwide. And as of 2016, we saw about 37 cases. So this is how effective that vaccine campaign has been. And most of these cases are occurring in countries like Afghanistan, Pakistan, and Nigeria, per the latest data from the WHO. Now, polio typically resides in the throat or the intestines of the infected individual and is commonly spread from contact with infected feces, which is why we see this in kids more often, where they're touching and everything's going into the mouth and may not have the best hand hygiene, just children being children. The virus less commonly can also be spread through contact with respiratory droplets, so sneezing and coughing from an infected individual, as well as contaminated water or food in places that sanitation isn't as great as it is here in the Western Hemisphere. Now, once the virus enters the body, it then multiplies in the intestine, from where it can travel up to the brain and spinal cord and potentially cause those more severe symptoms of paralysis. Now, anyone who is not vaccinated against polio is at risk. And within this category, there are a few higher risk factors as well. So children, again, under the age of 5, people who live in or are traveling to areas that polio is a bit more common, and then people with a weakened immune system are at risk of developing polio and its complications.
So if you do catch it, though, how do you treat it? And then I guess more importantly, how do you protect yourself?
Of course. So unfortunately, there is no cure for polio. Treatment for polio is usually supportive and really depends on how the patient is presenting. This can include anything from IV fluids to help with hydration, medications to help with pain or muscle spasms, and also to prevent complications like pneumonia. And oftentimes we have to include physical therapy or occupational therapy to help alleviate pain and strengthen the affected muscles. And in some instances, surgery may be necessary necessary to correct deformities that are caused by the paralysis. Now, as you mentioned, the best way to avoid this disease is through vaccination, and that is the best preventative strategy we have, and we know it works. Again, over the last 3-4 decades, we've really seen such a dramatic drop in cases internationally. Currently, we have the inactivated polio vaccine as well as the oral polio vaccine. Here in the US, we have the inactivated polio vaccine that is typically given in childhood starting at the age of 2 months, and it's given as a series to help continue the protection, which is usually lifelong. Most adults here and in the Western Hemisphere actually have already been vaccinated during their childhood or have had polio in their childhood, so they're fully immune. And that is why the polio vaccine is actually not considered as a routine adult vaccination. However, if you do know that you have not been vaccinated before or are incompletely vaccinated, it is important to talk to your healthcare provider, and we can get you up to date to prevent complications from polio.
Well, always good information. So Dr. Narula, thanks for joining us.
Thank you so much for having me.